It's still this morning on Metro TV. This morning we are looking at retention of urine or urine retention, and we have Dr. Prince Osei from Medi, who is a medical PRO. Doc, good morning.
Morning.
How are you?
Well,
we're telling Doc that Friday morning we're dripping.
Friday, not doing me so. He's got plans for the day and beyond.
And they can't meet big boys and girls.
But Doc, let's move straight to the conversation. First off, between men and women, who is most at risk when they retain urine?
Okay, so mostly women, men get urine retention, but women can also get because of some of the activities that women do. You know, there are some women who keeps urine on them throughout the day, especially when they go to their workplace. Some women don't even visit the washroom for risks of contracting some STI, UTIs and all that. So keeping the urine on you for a very long time will concentrate the urine, and when the urine gets concentrated, it crystallizes, and that is where the stones are formed. So most women get urine retention, but men, because of the prostate in men are more likely to get urine retention than women.
Wow. I want to ask what urine retention is, so we know the duration that maybe 1 hour is normal. Beyond 1 hour, that is when it gets serious. You can take us through that.
Okay, so when we talk about urine retention, you know, sometimes we take for granted some of the things that we can do, like passing urine, like waking up, raising your arms and all that. But when you get a disease condition, when you are unable to do some of these basic activities, then you appreciate what health is. Urine retention is just the inability to pass urine. So like you feel pressed, you want to go to the washroom to pass the urine, but the urine is not flowing. Yes, so it's not about you keeping the urine on you, but this time around you want to bring out the urine, but it's not coming. So that is where the problem is. And you know, it can be very painful. Imagine you being in the bus to Kumasi, and on the way you get to a place where you want to pass urine, the bus has stopped, you go to the washroom and the urine is not flowing. You can feel the pains and all that things that you have to, or in the middle of the night you wake up to pass urine and the urine is not flowing. That is what we call urine retention. So it means something may be blocking the urine. Yes, so sometimes if there is a blockade, if something is blocking the urethra, you know, with men, when you look at the tip of the penis, there is a hole there. That hole leads into the bladder. And there is a tube from the hole to the bladder. So that is what we call the urethra. So the urine, one of the stones can get blocked within the urethra, or something may be preventing the urethra from opening up for the urine to flow. Yes, so that can bring about the retention. Or sometimes communication between the brain and the bladder. You know, the brain will let you feel like you want to pass urine. You go to the washroom, the bladder will relax so that the urine will come. But in some people, that communication is not there, so they tend having urine retention.
So it's not about you keeping urine. Is that a contributing
that factor? Is a risk factor. You know, when you keep urine on you for long, urine sometimes, you know, urine is a bit salty. It's sodium chloride basically, and sodium chloride is salt, the salt that we know. And we all know of these local salts, the one that hasn't been processed. You know, it's a bit crystallized and all that. So that is how salt comes about. It's in those forms of crystals. So when you keep urine on you, or when conditions happen and your urine is not able to come out, they get concentrated and these crystals are formed. Yes, so when the crystals are formed, then it forms these bladder stones, kidney stones. I believe we've heard of those stones. So some of them can get blocked at the tip of the urethra, so that the urine wouldn't be able to flow. So basically, when you keep urine on you, it's not a good thing. That was why I was advising the women at the earlier part that we shouldn't keep urine on us for a very long time.
That's a lot.
No, because like I do that sometimes, like a lot of times. You know, like maybe I've got to go to the washroom before set. I say that, okay, you make a go count. Then I'll get on there, then I'll forget myself, you know, it does happen.
And mostly when you do that, that communication, you know, when the brain communicates to the bladder that you need to pass urine, that communication is active. But when you ignore it, with time, that communication may not
be off.
Yes,
Okay.
yes. So we have people with chronic urine retention, and we have people with acute urine retention.
Are those the types?
Those are the types,
Okay.
yes. So with a chronic retention, it means that it's a deliberate thing. As what you've been saying, is a continuous thing. You feel like urinating, you hold on.
Ignore.
So some of the urine may be left in when you go to pass, or wouldn't come and all that. So they will build up in your bladder. But with the acute one, all of a sudden, sometimes people even think they are being bewitched or something. People come to the hospital and they think that someone is working on them. You know, we are in Africa, so people think of so many things. Because during the day, you've been able to pass urine, and all of a sudden, the urine is not coming. Yes, so it's a medical emergency that needs to be pay attention to.
Yeah. I mean, so what actually causes all these blockades? As in, you are fine, you are there. You've mentioned that the continuous ignorance of these things. Is it the only one, or there are other things too, or food, fruits, maybe stress, something?
Yeah, so there are other things. With the women, mostly the bladder stones is what mostly causes it, because women are fond of keeping urine on them for quite a long time. So at Med Moses, most of the women that come there, we'll do our test and we'll realize that they have a bladder stone or a kidney stone that is blocked the urethra or the passage of the urine, causing the retention. And also with men, because men have the prostate. Prostate is an organ that lies below the bladder. So the urethra passes through the bladder. So when the prostate is enlarged, when the prostate becomes big, it blocks the passage of the urine. It's like taking a drink with a straw. You know, the straw is like the urethra, your hands is like the prostate, your fingers. You holding the straw like this and pressing the straw, you see that you wouldn't be able to bring out the drink. The same way, when the prostate enlarges, it presses on the urethra and the urine wouldn't be able to flow. So that is with men. And also we have a condition called urethral stricture. So when you have a UTI or urinary tract infection and you don't treat it well, sometimes the urethra may become sore. And you know, when some people heal from sores, they get some scars within the body. Some of the scars can become very big, like keloids and all those things. So within the urethra, when you have a UTI and there are sores within the urethra, some people may develop these sort of keloids, not necessarily keloids. I'm using keloids because that is what mostly we see. So it can become big and it can block the passage of the urine. So it happens within the urethra and it blocks the passage of the urine. So these are some of the things that can cause the urine retention. Also people with stroke. When you get stroke, you know, mostly it has to do with the brain. So the communication between the brain and the bladder ceases. So these are some of the things that can cause urine retention. But I personally chose this topic for us to discuss this morning because women are increasingly having this problem. At first, we used to think that it's only a men problem.
Like men problem.
And at Med Moses, because we deal with mostly men conditions, within this week, we've realized some women are also coming in with urine issues, and our check shows that it's mostly because of these bladder stones and kidney stones and all that is causing all these conditions. So that is why we picked this topic to discuss this morning.
Okay, so I guess we'd have to do a part 2 of this to get into it, more. So what is the remedy for it?
So it depends on the underlying cause. So when you come to Med Moses, we do tests to find out what is causing it. But when you have an acute retention and you need something that can relieve you, Prostate is there. Med Moses, we have a product called Prostate T. We have the capsules too. That is to improve urine flow. So with the Prostate is in so many, the mechanism of action is quite many. Let's say when you have a bladder stones or a kidney stones, the Prostate is able to break down the stones. When the stones are broken down to smaller pieces, it can pass, the urine can
it can pass out as urine.
Yes, as urine. Yeah, we have people taking the prostate cure, and when they urinate, they will see the stones physically. Yes, in the urine, it's able to break it down in that way. And also, if your prostate is enlarged, if you're a man and your prostate is enlarged, prostate cure is also there to reduce the prostate size so that the pressure on the urethra wouldn't be there for the urine to be able to flow well. And also, when you have it, if it's acute and you can't do anything about yourself, you can come to all of our centers, Medi Clinic and Prostate Centers. So if you are in Accra, we are at Adenta Barrier. When you are coming from Medina to Ebri, we are at the Adenta Barrier, just close to the Adenta police station on your left side. That is where we are. If you are in Accra Central, we are at the AESL building, close to the Ministry of Road and Highway. If you are around Tema and Ashaman, we are at Ejay Kojo, behind the School for the Deaf. When you are in Kumasi, you can also go to Ahinema Kokobin. We have also our branch there. But when you are in any other parts and you feel pressed or you need something to relieve you of urine retention instantly, Prostate Cure Herbal Tea, Prostate Cure X capsules is there to relieve you of that condition.
Thank you so much, Doc, for coming today. What's the plan for the weekend?
He'll be at the clinic attending to people, men, women.
You see.
Maybe you can come to that for centric today. But thank you so much for coming.